Okay, about a 20-minute news conference by Dr. Zane Cohen, Mayor Rob Ford's doctor, giving us a rundown of what the diagnosis is. I'm joined now by Dr. Akbar Khan to sort of break down some more of this, although that was a very full and informative conference. This diagnosis, this liposarcoma, incredibly rare according to the doctor. What are you gleaning from the information that we've received so far?
Well, what we've got so far is that it is quite a rare tumor. It's certainly not one of the top 5 that we see, the ones you think of, like breast, colon, lung, prostate.
The size is sort of
the size is about 12 by 12 centimeters. Here, it's a fairly big size, and I think it's concerning that it has spread. That would put it at a stage 4.
And now Dr. Cohen was really resistant to mention any kind of staging, but when the cancer does spread beyond the initial site, it is considered a stage 4.
Yes, that would be any distant site, they would call it a stage 4.
So the initial reaction that I get after watching that news conference, and probably the people who are watching as well at home, are wondering why not just take that tumor out?
Right, well, surgery certainly can have a role with sarcoma treatment, and in some cases surgery can be curative for sarcomas. I'm not exactly sure, but I would speculate that because it's a stage 4, they probably want to shrink it first and want to see if they can get rid of the buttock tumor, if that will disappear, and the main tumor, because it's a fair size, if they can shrink it down, it might be easier to operate on, and it might improve his chance of cure.
Now, from a medical standpoint, the doctor mentioned pleomorphic liposarcoma. What does that pleomorphic mean?
Pleomorphic is just, it's a very technical name. It's more related to how it looks under the microscope. Pleomorphic means variable shape. But the main thing really is that it's a sarcoma. It's the classification that is the most important. It's a tumor that comes from the soft tissues. So in this case, it's a fat-related tumor. Other sarcomas would be ones that comes from muscle or bone, for example.
Now, when Dr. Cohen describes this as an aggressive cancer,
yes,
what does that mean in terms of, I mean, a couple of the reporters there, including our own Cynthia Mulligan, tried to get some answers from him about prognosis, about the long-term impact that this could have on his health. What's your knowledge of that? Okay,
so it could mean a couple of things. One is it could mean that it wasn't there recently and it just came up and it grew very quickly, so that could be what he means by aggressive. The other thing is when they look under the microscope, again, the tumor might have certain characteristics that they would perceive as aggressive and maybe difficult to treat. So he didn't really get into detail, but that's what we can speculate.
And it was interesting to note that he started by saying that he was optimistic, yet at the same time called it an aggressive tumor, said that he was treating it aggressively. And when we look at the fact that it's stage 4 and that they're going to be using sort of massive doses of pretty hardcore chemo drugs,
yes,
what would your analysis be of just how serious this might be for the mayor?
Well, it sounds serious to me. I mean, it's going to be a difficult cancer. I think that even though it's stage 4, the optimism is that there's only found one tumor at a distant site. So again, there is potential to shrink that with the chemo, potentially make it disappear. And if they can shrink the main tumor enough and they can operate on it, then you do have a possible chance of getting rid of this completely.
Because you say that's a distant site, we know that this liposarcoma, 1% of all cancers are. I mean, but this really is incredibly rare.
It is quite rare, and for that reason, people might have a lot of questions about it, but we just don't have data. Because it's not one of the common ones, there isn't that much research on it. Not that many people get it. So it might be difficult from that standpoint too, because the number of treatment options could be limited.
Awesome.
Compared to breast cancer, for example.
Okay, great. Thank you so much, Doctor. Really appreciate your medical insight into that. We've only just obviously learned about this news about Mayor Rob Ford. Already a lot of people this has just completely exploded on social media. I'll send it over to Tom, who's talking about that.